We want to thank Dr. Tsion for being here with us today. She is the Doctor of Emergency Medicine in New York, as well as a special advisor to the Ministry of Health of Ethiopia. And we appreciate her for serving on the front lines, for all that she does, along with all of the healthcare workers sacrificing so much right now. And I also want to make a couple disclaimers about this session. Number one is that Dr. Tsion is not representing any organization she works with, and she's not acting as a spokesperson for any organization she works with either. And she also will not be issuing medical advice during this session. Dr. Tsion, you yourself had COVID-19. This is something that, you know, for all of us, it's so close to us, you know, and I think we sometimes don't realize that, but you yourself had it. And if you could just describe what that was like for you, and not even just from a physical state, but as well as emotional.
Initially, when I showed the symptoms, I was in denial, like, oh, maybe I'm just too exhausted from working in the emergency department, and that I am also a bit just overwhelmed with what's going on. So most of it, I would say, you know, it's not the worst symptoms I've had. Like, it's very difficult to remember, like, you know, the symptoms once you're over it. But I actually kept a video journal and all of that. And the most intense part for me was the headache. You know, I do get headaches, but it's just like unrelenting headache. And the body work, especially the first few days, was very intense, I would say. And that felt very like long. And me, for people that don't know me much, I'm not the kind of person to sleep all day unless I've worked overnight. But literally, I was just sleeping constantly. I would wake up. Thankfully, my appetite was good, and my husband, who had it too, so he was recovered. So he was making sure that you know, I'm staying hydrated and eating and all of that. And I tried to distract myself as much as possible from feeling the body aches and the pain. But the first 4 days is just, I think I went through it with sleeping. And then it just drained me so much. Even when I felt better, I would get up and do my usual things. It's not like going out, but like reading, working, and talking for meetings or attending different there were like a whole bunch of media appearances that I had to cancel. So I tried to one day get up and do it like for 30 minutes. After, at the end of it, I just felt exhausted. Like I just ran, I never ran a marathon, but I just felt like I went for like a good hour run, and I just would go back to sleep. So it drained me. And just to give you, this is my personal experience, but again, thankfully, I didn't have a lot of the lung manifestations. I didn't have cough, shortness of breath. It's just the fever in the body. It was so intense on me. And emotionally, I would say I tried to distract myself. Of course, I couldn't be as active on social media, but it was an overwhelming. I didn't tell that many people because I don't want people to worry. But the people that knew, it was very helpful to know that many people supported me and that a lot of people were thinking of me. That helped a lot. And I would say I knew, there was also a piece of reassurance that felt like, finally, I'm going to be immune to it. So this is going to be me going, hopefully, I hope I don't have to go through it twice, but it's just like, this is over and, it's going to be better. And there are times where I was like, oh my goodness, like, I'm not going to survive this. But all those thoughts, do run through your mind. And, I actually feel very blessed to have my husband support me through all this thing, and my family, my friends who prayed for me, who tried their very best to cheer, sending me a whole bunch of things. So that's been very helpful.
Wow. That is it's very touching, and I think for all of us in this chat, just to hear your story. And another reason it's really important to hear your story is for all of us to know as well that you can recover. And this is a living testimony. She's an example of someone.
What can we do? I think stay home for all of us. A lot of people in this country are doing it. In New York, unfortunately, we learned it a lot later. And it's really, for me, I just think that this is social distancing is the battle now. And it's really about us practicing it. Think of it like a war. You don't see the witness. You don't witness the war because it's happening behind the hospital gates. So it's important that this is almost the equivalent of the Third World War, and that you as an individual do your part to stop the war by staying at home, and let the people who are fighting it, let them fight. And one thing I would say, I think as a culture, especially for Ethiopian Eritrean culture, there's a lot of stigma about people that are isolated, that are recovered. I think it's very important that um, the solidarity with everyone, and that we continue to support and check on everybody that has recovered. So I think it's important that, especially people that are here, we have so much access to information. So if we have family members back at home, very important for us to teach those things, that, you know, people are, it's okay to physical distance. Like, social distancing doesn't mean that you can't call and check on them, that you can't tell them that you're praying for them. Those are okay. It's just like, you know, we're not there, and we won't be there physically next to each other, but I think it's very important that we show solidarity with people that are recovered. I mean, I've witnessed it. I've witnessed the stigma with getting sick with COVID, and it's very, very important that we, as a country, as a culture, as a human being, that we don't pose any kind of stigma towards people that are recovered.